You probably already know that the term blood pressure is used by doctors to measure the force of your blood pushing against the walls of your arteries. An accurate blood pressure reading gives your doctor a way to diagnose your risk for heart disease, stroke, and a variety of other health concerns. Here are some questions patients who have high blood pressure or hypertension are likely to ask their doctor about what high blood pressure feels like. What would be considered high blood pressure? Blood pressure, often simply called BP, is measured by using two numbers expressed as a fraction. Your blood pressure is judged to be high if it's 130/80. The first number, called systolic blood pressure, measures the pressure in your arteries when your heart beats. The second number, called diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. What can happen if your blood pressure is too high? A high blood pressure reading means there's extra strain on your blood vessels, heart, and other important organs, including your brain, kidneys, and eyes. This can create a number of serious and potentially life-threatening dangers, such as heart disease, heart attacks, and strokes. What is considered a dangerously high blood pressure? If you get a blood pressure reading of 180/110 or higher more than once, you should see a doctor immediately. A reading this high is considered a dangerous hypertensive crisis and requires quick medical intervention. What triggers high blood pressure? A diet that's high in salt, fat, and/or cholesterol is most likely to trigger high blood pressure, but it can also result from chronic conditions like kidney disease, diabetes, high cholesterol levels in the blood, and hormone problems. Family history or heredity can be a factor too, especially if your parents or other close relatives have high blood pressure. Do you feel unwell if you have high blood pressure? Most people who have high blood pressure don't know they have it because they don't experience any obvious symptoms. This is why hypertension is sometimes called the silent killer. But high blood pressure can sometimes make you feel unwell in the following ways: chest pain and discomfort. Some people even feel a pounding sensation in their chest, neck, or ears. Fatigue, often accompanied by feelings of weakness. Difficulty breathing. Nausea. Nosebleeds. Severe headaches. Vision problems. Irregular heartbeat. Blood in the urine. A general feeling of unease, confusion, or other cognitive issues. What should we do when BP is high? If you have some of the symptoms described in this video, they should never be ignored. They are warning signs that something dangerous might be going on with your blood pressure. See your doctor, who is always your best source of information about high blood pressure and other health-related matters.